Hey there, Empowered Tribe. It's Angela T. Moore. You are getting ready to experience the 16th episode of Empowered, a health and wellness podcast where I share my personal journey of health and healing, tips for mental and physical health, interviews with health and wellness experts and those bold enough and vulnerable enough to share their own journeys to empower you to succeed in yours. We know that life can be rewarding. It can also be challenging. It has its ups and downs, highs and lows. I learned that with a strong mind and a fit body, you are better able to grow through and grow from whatever life throws your way. My goal is to share journeys of health and wellness, as well as tips and information from extraordinary people all around the world to help you live an empowered life. My guest, Erik Gallery, is a director of statewide access and early identification initiatives at the Autism Alliance of Michigan. In his role, Erik oversees the organization's MiNavigator and outreach and community engagement initiatives and leads an interdisciplinary team of professionals that serves families and individuals impacted by autism from the early stages into adulthood. In this episode, Erik talks passionately about the importance of providing the support and the resources individuals with autism and their families need to live healthy and fulfilled lives. According to the Centers for Disease Control, autism affects an estimated 1 in 36 children in the United States today. Erik shares many of the challenges that autistic individuals and their families face, but also how Autism Alliance of Michigan is committed to ensuring people with autism lead lives that meet their greatest potential. I hope you enjoy the episode. Autism or autism spectrum disorder refers to a broad range of conditions characterized by challenges with social and behavioral skills, as well as speech and nonverbal communication. According to the Centers for Disease Control, autism affects an estimated 1 in 36 children in the United States today. My guest, Erik Gallery, represents the Autism Alliance of Michigan, an organization committed to ensuring people with autism lead lives that meet their greatest potential. I love that. Erik, for people who may not be familiar with the Autism Alliance of Michigan, can you tell us about the organization, the work that you do?
Yeah, absolutely. So the Autism Alliance of Michigan, we are a statewide nonprofit group. And our mission is really to provide guidance and resources to all those that are touched by autism, really a lifespan of needs. Really the central way that we do that is through our flagship service, which is the MiNavigator Program. That program.
It's the what?
It's the MiNavigator Program.
Okay.
Yeah, it's our flagship service here at the Alliance. And that program, it's made up of an interdisciplinary group of professionals that range from behavior analysts, occupational speech therapists, social workers, folks with education backgrounds, and those with lived autism experience as well. Individuals from across the state can connect with us. This is a free resource. And what we offer is resource identification and then professional consultation as well when it comes to these really varied needs that we see with autism. And our intention is to really serve a diversity of the state. It's not just families and caregivers that are experiencing these needs. There are many adults with autism, autistic individuals, and of course providers that are out there really attempting to provide quality services with some of the complexities of the needs that we see with autism. Many times they need further support, so we try to offer that as well.
Gotcha. Well, I've had the opportunity to interview a number of individuals from Autism Alliance of Michigan over the years. This is my first time talking with you, so I'm very honored to talk with you. I know that autism affects a lot of people, either directly or indirectly. So usually if you don't have someone within your household that has autism, you know of someone that has autism or, as you say, autism spectrum disorder. It's interesting because people use that term kind of interchangeably, like, autism and autism spectrum disorder. Can you kind of expand on that?
Yeah, well, autism spectrum disorder, it really says that this is truly a spectrum disorder. There's a variety of needs and, different variances that we can see with different individuals. I think when we start to see some of the differences in that terminology, that kind of gets us into some discussions around person first language and identity first language. There's many autistic individuals in our communities that have really felt a sense of identity when it comes to having autism or being autistic. And, we at the Alliance, as the years have gone on, as those prevalence rates have increased, as we've seen more self-advocacy happening, we're really trying to be at the forefront of that and really demonstrating sort of our flexibility and when it comes to that need, because, there are many caregivers, many parents that aren't seeking to embrace that. And that's okay. It's really up to the individual person as they grow and they progress, how they want to look at those preferences. So we definitely try to maintain sensitivity to that and know that we're going to need to be adaptive when serving those individuals.
Mm-hmm. Yeah, I think adaptive is a very key word.
Mm-hmm. Yeah, exactly. We want to make sure that, what we're providing service-wise is not only quality and relevant, but it's meeting some of those specific cultural needs that we're definitely going to encounter when we're truly trying to serve the entire state.
Mm-hmm. Mm-hmm. Now, one of the things that I've definitely recognized is that it's often the lack of resources that make it difficult for someone with any condition to get the help that they need to more effectively deal with that issue, as well as to help those people that are trying to support that individual with a specific condition. What are some of the resources that Autism Alliance of Michigan has available for individuals living with autism, as well as their families and their caregivers?
Yeah, I would say really the primary tool that we can offer, and it's a part of our MiNavigator program, is our resource directory, which just went through a recent update. That resource directory is comprised of over 1,400 different providers across the state. What we've recognized as we started in serving the autistic community was there's lots of great pockets of quality services distributed all throughout the state. The issue is there's been a lacking connection in really demonstrating and bringing about awareness of where those providers are, what they can offer, what insurances are they credentialed with. And what we've done with this directory is to do our best really to centralize those resources so that they're readily available to the families, to the providers, to whoever is dealing with a specific need that's trying to find a regional specific and relevant resource to address that need. And that resource directory, while it's used often by MiNavigators in the program, this is a publicly accessible tool that lives on our website, and we want individuals to find it, discover it, and engage with it. It can really help that search, really help minimize some of the steps behind that search that happens when seeking services.
Right. Now, I want to make sure I understand the distinction, because there's the Navigator program and then there's the resource directory. Can you talk a little bit more about the Navigator program? And then if you can explain why, I guess, in more detail of why Autism Alliance in Michigan decided to centralize, all the resources. I mean, it seems logical, but obviously there is a reason, a motivating factor that made it happen. So if you can, really make the distinction between the navigation program and the resource directory, I think that those that are going to listen to the podcast would really appreciate that.
Yeah, of course. So the MiNavigator program is, the best way to describe it is, while it does look like a case management service, it's not the same thing as case management. We don't take on individuals and remain with their cases long term. What we're doing is we're that sort of ad hoc, supplement that can really help to address some of the needs that are happening specifically related to autism. Our goal is, I'll give you an example. Many times families reach out to us as really some of their initial steps and trying to address needs of autism with their children. A common case that we serve is trying to find a diagnosis center. to gain an evaluation to really understand that diagnosis of autism. And then from there, the needs can grow. Families may be reaching out to us because now they have a diagnosis of autism, but now they're seeking a clinical service provider to treat a specific communication-based need or something involving social skills or a behavioral concern. So that's really what the Navigator program looks like in essence. It's that one-on-one connection with the family, with the person affected, to be able to identify the resources that they need for their unique issue, and hopefully being able to deliver on finding something that's going to address that need. One of the reasons why the Navigator team is made up of the interdisciplinary group it is because we wanted to ensure that it was professionals that already had a prior background in addressing some of these needs that would be on the other end of that call or the other end of that email. What we see many times is there are individuals that are struggling with some of these needs and they don't know the resource that they're looking for. They don't know that the service exists. So our navigators are really there to help dissect that need a little bit more and ensure that they're delivering on a solid resource.
Okay. And I could definitely see why that would be needed, because I imagine if you were not familiar with the challenges that someone has in that unique situation, you could really be a disadvantage to that person that's seeking your support.
Yeah, absolutely. And, to answer your second question regarding, really the why behind why we centralize our resources, it would seem obvious, like you said, but, just looking at the Navigator program itself, we recognize that there needed to, be a change to centralize these resources because we needed that. To really be able to ensure that we knew where the resources were, we knew where these services existed in relation to individuals across the state reaching out to us. We needed a tool that was really going to help us to find those options. And when we hear about some of those services in our random newsletter and email, or when we're out in a community event, we wanted to make sure that we had a database that was ready to go to start housing that. And the next obvious step with that was to make it publicly accessible, because we recognize that, there are many individuals that just may not be looking to connect with another person. They've got enough going on in their lives. They're managing behaviors, they're managing things with their family, and they just don't have the time to, get on a call. And maybe it's easiest for them to be able to just access that directory any time of the day, at night, once the kids are asleep, and do their own searches. And when the time comes, Navigator is there to step in and, address any barriers that may come up from actually getting into that service.
Gotcha. Now, one significant thing that I've recognized is that organizations that have worked with communities for a significant period of time, they are perfectly positioned, I kind of alluded to this earlier, to address the recurring challenges of the communities that they serve. What are some of the most common recurring challenges that you see in the communities that you are currently serving or have served for a period of time?
One significant one that comes to mind are barriers around transportation.
I'll give That's an issue I hear about a lot.
Yeah, and when you really think about some of the challenges that some of our families face when they're really doing their best to find a quality services like ABA, Applied Behavior Analysis. This is one of the most frequent services that are provided when it comes to addressing behavioral needs related to autism. These services are intensive in the fact that they require a large commitment. It's not like just going in for clinical therapy once a week or once a month. This would be a Monday through Friday type of session. So you have to think about it for a family that's already getting their children to school. Now they're getting them to a separate therapy service. They're back. So it's sometimes not as simple as, with just getting to that service in the one day. We have to consider the extra expectations that some of these families face with that. So transportation is definitely one of the more significant ones that we hear. Beyond that, I would say that accessing the services because of insurance-based barriers, financial concerns. Those we hear often as well. And that's where we have to do some digging to find, what additional benefits and insurances are available for these persons, whether it's Medicaid, whether it's SSI or SSDI. We have our full gamut ready as far as all the resources that we know about nation and statewide. And we do our best to guide those individuals towards those options to help address the barriers.
Mm-hmm. Mm-hmm. Now, one of the things that I think is really significant is something that I recognized many years ago. And I had a radio show that I did for 5 years, and I assigned a very significant part of my radio show to create an opportunity, a platform really, for organizations like Autism Alliance of Michigan to be able to share the work that they do. Because I found that oftentimes you had people within communities that did not take advantage of the resources and services and programs that a lot of the organizations offered because they didn't know of them. And then you had individuals that were trying to be of support to individuals within their families that had special needs or had health concerns. And many times they were struggling in areas that you had organizations that could, lighten that struggle, could lighten the load. And for many months or years, they suffered trying to manage and take care and do all the things that you do whenever you're trying to support someone. And sometimes, that burden is so heavy. And I think it's just a shame that you could have an organization that's right there that could literally lighten your load and has the people that are familiar with the issue, have often done what's necessary to address that issue, has the resources, has the partnerships to help you, but people simply don't take advantage of it. So why do you think it's important for people specifically living with autism or people who are supporting people with autism to know about the work that you're doing?
Well, we've unfortunately seen that situation that you described firsthand. It's ironic at times that, we see the greatest density of persons with needs in areas around the state, specifically in metro areas, that also have the largest density of services, of resources. Yet there's something missing there and that connection between them. And I unfortunately don't know exactly what that is, but, when it comes to Autism Alliance, beyond the MiNavigator program, we have our outreach and community engagement team that is really focused on getting into these communities to ensure that the awareness is there. Our services are only as good as those who know about them and actually utilize them. So we rely on that team pretty heavily to prioritize key regions across the state, ones that we feel are showing that lack of awareness, to get in there, partner with community partners to really try to not recreate the work, but be a part of the work that's already happening in those communities, and hopefully drawing more folks to us to be able to give them the resources that they may need.
Mm-hmm. Now, I imagine that the burden that's felt by individuals living with autism and their families, as I was just mentioned, is extremely heavy. But I, of course, understand that your organization has been committed to providing solutions. We're talking about those solutions. We're talking about the resource directory. Can you talk more about that very important tool and some of the examples and that it will help the autism community?
Yeah, absolutely. I feel like we've been talking a lot about the clinical service provider aspect, but I wanted to be clear that while there are a number of clinical service options in the resource directory, we've really tried to do our best to ensure that the options there are more of a holistic experience. We recognize that the needs that some individuals, some families are facing are not strictly to developmental or behavioral concerns. We have many adults that are reaching out to us because they're looking for further opportunities for recreation, peer interaction. We have individuals that are reaching out to us because of health-based concerns, not so much their clinical or behavioral health, but health-based concerns in terms of trying to find a facility that they'll feel will be accommodating for some of their recreation needs, looking for adaptive sports. So we've really done our best to identify as many of those relevant options as we can. There are a number of filters in the directory that range from the clinical services and the location of the service, being if it's in person, if it has telehealth modalities. But we also have filters based around specific insurances for resources that are applicable to that. And then we break down those resources even further by the specific counties across the state. So there are multiple filters that a person could use to really get a more focused experience and not be overwhelmed by that 1,400 plus listing that currently lives there.
Yeah, definitely. Well, what you speak about is what I've recognized, and I think many organizations are recognizing more, is the need for a holistic approach, and access to resources that support the whole person. Is oftentimes, and I said this with another organization I had interviewed some weeks ago, that we often will define a person by their issue, and you forget that these are people that have, goals and dreams and aspirations and things that they aspire to be and do. And that they also like to, do things, like you said, for recreation, for entertainment, for their health, for their physical health, for their nutritional health, all those different things. And being able to, if you do have a unique, concern like autism spectrum disorder, being able to have access to those different areas of your life that represent who you are, but with with autism in mind, so that it is going to cater to you specifically to address that need, is so important.
It is. And, you're right in what you said before. Unfortunately, we do come from a place where, unfortunately, folks are quick to judge, and that significant issue, that significant need becomes the identity of that person. And when people think about some of the other options that might be necessary to their child, in the terms of a whole holistic approach when it comes to that overall wellness, sometimes those needs get overlooked because there's just too much of a focus on that problem, and say problem lightly, but just that thing that people look at when they first, at the very least, ensure that those options are widely presented, to ensure that folks can have that access. They are able to engage with them.
Yeah, most definitely. Now, I understand that Autism Alliance of Michigan received increased funding from the state of Michigan to raise awareness of program and to build out things like the resource directory that you just launched. Can you tell us about the need here in Michigan and how you guys are serving the autism community across the state?
Yeah, that increased funding helped give us some means to do just that, really. On average, the MiNavigator program over the last few years has been serving anywhere from 3,000 to over 4,000 individuals.
So 3,000 to 4,000? Okay.
3,000 to 4,000. That's been our average. And, with that comes a lot of individuals that need to be there to be available to take those calls, respond to those emails. So a big part of the funding that we utilized in this last fiscal year was to grow our Navigator team, to bring on additional staff to really not only assist with the value, but to ensure that we're still going to be able to provide the most quality that we can when we're engaging with the person. Our stance is to really act as a guide when navigating these needs. And that requires time, requires commitment. So with that increased funding, other than just updating the directory itself, giving it a bit of facelift and really improving its ease of access, the largest parts of that funding to really build the team, make sure that we have individuals prepared to take those calls.
Yeah, I imagine that's so important when you are calling to gain access to resources and to ask questions that you really want the answers to, and to get the information that you need. It must be really nice to be able to talk to passionate, qualified people that have been put in place to do that.
Yeah, that's exactly what we're trying to do. It's no secret that there's been a crisis when it comes to the workforce across the country. And behavioral health, clinical services are no stranger to that. Many families are facing wait lists. They're waiting to get calls back. They're waiting to get a diagnosis. And, we don't want to add to that problem if we don't have to. If we can be available to help those individuals